Myself, Dr. I'm currently working as the medical superintendent, head of the department of Panchakarma at All India Institute of Ayurveda. And thank you for a warm welcome. I don't feel much familiar faces here because one or two familiar faces I can see. Other than that, all are new faces to me. So I came to know that all state representatives are present here. The medical officers from all the states are assembled here. So this is a brief refreshing, what I would like to call it as, because I'm not going to detail about the different research aspects or administrative aspects of the diseases. Instead of that, it's a purely classical based, the practice based orientation towards the three conditions, rheumatoid arthritis and osteoarthritis and cervical spondylosis. So as you know, all these disorders, musculoskeletal disease comes under the musculoskeletal diseases comes under the Madhyama Roga Marga, and Sandhyasti Marmashita Rogas are there. And you know, the majority of the outpatient cases or the OPD cases which is coming to Ayurveda doctors belong to these conditions only. And we have the abundant confidence to treat these conditions, but still many of the times due to improper advocacy of the therapeutics or the medicaments, especially the applications of oil and the ghee preparations in these conditions may become worsen also, and you might have experienced that in your clinical practices. The Panchakarma is not the total solution for all these conditions. Don't think like that. Panchakarma, when we have to apply and how we have to apply, that is also very important. Seeing this shloka, Shreshmatva Adayusho Yapyam Asadhyam Patya Sevaya Labdalpa Sukham Alpena Hetuna Ashu Pravartakam Gambiram Bahu Dhatustam Marma Sandhi Samashita Gambira Dhatusta Nityanushayinam Rogam Dirgha Kalam Avastitam Vidya Dvidoshajam. So, Dvidoshaja Rogas and the Marma Sandhi Ashritas, generally considered as Yapya or Kricha Sadhya, many times Asadhya also. So these Yapya Vyadis are coming to us, and we don't have extra confidence to tell the patient that we will treat completely because they are Yapya in nature. That we should remember always. Because many of these conditions are either it is autoimmune in nature or degenerative in nature. Dhatu Kshaya is one of the inherent quality or the nidana or the samprapti of these conditions. You need to think. So Madhyama Roga Marga, Marma Sandhyashita are the Yapya and many times Asadhya Vyadhis. So when the patient approaches an Ayurvedic physician in your clinic with these problems, joint pain. Pain is the cardinal feature in all these conditions. Complaining of pain in joints, either it may be due to osteoarthritis or it may be due to rheumatoid arthritis or any other arthritis also we can consider. So the pain relief is the primary motto of all the physicians whenever we see such kind of patients. And as I mentioned, it is Yapya. We have to be always cautious and we should take all the necessary precautions when we do the treatment of these patients. That should be in terms of proper history taking. That should be in terms of proper understanding of the dosha involved. That should be in terms of proper understanding of dhatu involved. The samprapti, understanding of the samprapti. Avastha of the vyadhi, that is also very important. Because without understanding the avastha, the chikitsa itself is based on chikitsaya pradhanam avasthanu vidhanam. So the chikitsa is mainly based on the avasthanu vidhas. So avastika chikitsa, considering the various stages of the diseases, the intervention and the medicaments also may change, or we need to think about the modification of these interventions or medicaments. So that is why the understanding avastha, considering all these aspects, we have to go forward for the treatment of the these conditions. So some of the common clinical presentations, what we would like to see is that there are some functional abnormalities we can see, some of the structural abnormalities we can see, pain and rigidity or the stiffness we can see. So these are some of the common clinical presentation we can see in rheumatoid arthritis or osteoarthritis and cervical spondylosis. Functional abnormality, the Acharya says many terminology, uses many terminologies like Sandhi Shaithilya is there, Sandhi Muktata is there, Sandhi Vikriyata and Sandhi Daurbalya. So there will be Sandhi Shaithilya, Shitilata of the Sandhi. So the loss of strength of the Sandhi. It may be resulting into dislocation, frequent dislocation, maybe weakness of the tendons or the surrounding structures. Similarly, we can see structural abnormalities, Sandhi Vishlesha, Sandhi Bandha, Sandhi Spotana, Sandhi Vyapadana. So these terminologies also we need to understand before we start the intervention. Sandhi Spotana. Sandhi Spotana means we can, the patient himself may be telling that some sort of sound is coming out of the joint. It can be considered as Sandhi Spotana. Otherwise also we can understand any sort of minute cracks also we can understand in the terms of Sandhi Spotana. So we should understand the patient terminologies in which he communicates to us, and we need to translate into our classical symptomatology. Then only we can reach into a proper diagnosis. Then pain, Pida, Ruk, Vedana, Shula, Spotana, Vedana. Okay, so these are the few terminology. Around 41 terminologies are related with the pain, which is related with Vata also. Okay, so these are some of the common terminologies which is related to various kinds of pain in joints mainly. Pida, Ruk, Vedana, Shula, Spotana, Vedana. Okay, so the cruciating pain or the pricking kind of pain or the breaking kind of pain or the continuous satata pain, continuous pain, we need to differentiate these things. These are some of the structures which we see involved in these kind of pathologies. So entheses are many times involved, resulting in various kinds of enthesopathies, and we many times we misdiagnose it as the Sandhishula or the joint pain as such. But enthesopathies, there is the enthesitis, inflammation of the enthesis is also happening. So we need to intervene that condition based on the inflammation or the Samavastha, understanding the Samavastha. The bone structural changes, then joint capsule, cartilage, synovial fluid, and synovial membrane, bursa, muscles, and tendon sheath tendon. So these are some of the structures which are involved in the various kinds of joint pains which is related to musculoskeletal disorders. So coming to the dhatu involved, as I mentioned, many of the patients, when they approach a Ayurveda physician, the condition will be almost in the dhatu kshaya avastha only. So for the prakopa of the vata, as you know, there are two main sampraptis are there. One is the dhatu kshaya and another is the margavarana. Okay. So margavarana we can see in generally in santarpanajanya vyadhis. When it comes to the rheumatoid arthritis or the amavata kind of disease conditions, we can see many times margavarana. But otherwise in sandhigata vata or in the osteoarthritis etc., we can see the dhatu kshaya only. Mamsakshaye visheshena spigrivo udara shushkata sandhinam sputanam glanyor akshnor ayasa evacha. Sandhinam sputanam. Sandhi sputana is one of the lakshana seen in the Mamsakshaya. Lakshanam medasikshini tanutvam cha udarasya cha kesha loma nakha smarshu dvijaprapatanam shramaha. In the Majjakshaya we can see kesha loma nakha smarshu dvijaprapatanam. So all these are related with the asti also. Nyeyam astikshaye lingam sandhi shaidhilyamevacha. Sandhi shithilata also we can see in the astikshaya. Shiryanta ivacha astini durbalani laguni cha. Asti saushiryata or the asti shiryata. Degenerative changes occurring in the bone also we can see. So these are the dhatu kshaya lakshanas we can come across which is related with the sandhis. So understanding the samprapti, there are multiple sampraptis we can see. Multiple disease sampraptis can be incorporated into these diseases, like it could be dhatu pradoshaja, it could be dhatu kshaya or vriddhi janya, it could be the samprapti of vatarakta can be understood in some condition. The samprapti of vata vyadi can be understood. The samprapti of amavata, samprapti of sandhivata, samprapti of nanatmacha vata vikaras also we can understand. So pain in joints, if you classify into two, one is the practically it is two types. One is acute and the chronic pain. So acute arthritis, where we can see the pain like in conditions like infectious arthritis, gout, reactive arthritis, initial presentation of chronic arthritis. Similarly, in the chronic types like amavata or in the rheumatoid arthritis, sandhivata or osteoarthritis, vatarakta or gouty arthritis. There are difference of opinion may be there with gouty arthritis and amavata or gouty arthritis with vatarakta or rheumatoid arthritis with vatarakta and amavata. So that is what I feel is it is purely on academic interest. But in practical, we can clearly demarcate these two conditions as vatarakta, amavata of vatarakta, amavata as rheumatoid arthritis and vatarakta as the gouty arthritis. Because the vatarakta is the primary entity which is mentioned in all the samhitas, Bharatrayis. Vatarakta is the primary entity which is mentioned. Later acharyas, when it comes to the Nigandus or the Lagutrayis, only the evolving of the concept of Amavata comes. So if you see the Samprapti Nidana Lakshana of the Vatarakta, we can see that there are Sama Avastha and Nirama Avastha of Vatarakta itself. So many of the Sama Lakshanas or Sama Avastha of the Vatarakta is similar to that of the Amavata. So if you thoroughly knows the management of vatarakta, you can easily treat amavata also. Because only thing is we need to employ the sama avastha of the vatarakta chikitsa. Other related chronic musculoskeletal disorders like psoriatic arthritis, reactive arthritis, Charcot arthritis, like that, osteonecrosis, etc. So coming to the osteoarthritis, as you know, the osteoarthritis we can very well correlate or the understood in terms of the sandhigata vata, the vata which is vitiated in the sandhis. So either of this sandhi, any of the sandhis can be considered for this sandhigata vata. Need not be always Janu sandhi or the Gulfa sandhi, etc. Any sandhis where there is the involvement of vata, gatatva of the vata is there, we can consider it as the sandhigata vata. Vata purna dhritisparsha, shota sandhigate anile, prasarana akuncanayo pravartischa savedana. So vata purna dhritisparsha. So this is the, there are two kind of sampraptis are we can see in the text itself. The shopha is general, simple shopha is mentioned in sandhigata vata. The another thing is vata purna dhriti sparsha. So vata purna dhriti jaisa shobha. The shobha which is similar to that of the vata purna dhriti. So the air filled cavity kind of swelling also we can see. Prasarana akunchanayo sa vedana apravrti yo pravrtischa sa vedana. So during the prasarana akunchana of the joint, any of the joints which is involved, there will be the vedana or savedana. Along with the pain, they can do the prasarana akunchana. Vata purna dhriti sparsha shodha sandhigate anile prasarana akunchanayo pravartischa savedana. Similar in Ashtanga Hridaya. Hanti sandhigatan sandhin shula shopam karoti cha. Hanti sandhigatan sandhi. Sandhi. Sandhigata sandhi. So the Hanana of the joints, the movements of the joints is mainly seen in the Sandhigata Vata, along with the Shula and the Shopa. Kurya Sandhigate Anile, that is the Chikitsa. So what is the line of management for the osteoarthritis? As you know, there are the possibilities of Dhatukshaya and also to some extent possibilities of Avarana also there. But in majority of the osteoarthritis conditions, we can see that Dhatukshaya Janya osteoarthritis. Sometimes it may be related with Abhigadacha origin also. Abhigadacha origin also. So we need to understand the Abhigada or the Dhatukshaya and the Avarana. If it is purely Dhatukshaya Janya, then go for the Vata Hara Chikitsa directly. Or if it is Abhigada Janya pathology, then we have to think about the involvement of the Rakta also. Okay. So Vata Rakta line of treatment can be adopted. But in general, it is mentioned that Kurya Sandhigate Nile Daha Svedo Upanahanai. So Sandhigata Anila, in the Vata which is affected in the Sandhi, Daha Sweda Upanaha. Daha Sweda Upanaha. Daha means Agni Karma. Sweda, various kind of Sweda modalities we can utilize, and Upanaha. The only thing is, we should ascertain whether the condition is devoid of Sama or it is in Niramavastha. If the condition in Samavastha, in Sandhigata Vata also we can see the Samavastha, but the Samavastha, unlike in Amavata, the Samavastha will be less. But in case of Samata is there in the joint, at that time if you apply the oil, of course that will going to aggravate. So what we have to do, we can go for some of the external applications which causes the Rukshana, which reduces the ama in the body and reduces the inflammation or the swelling. Then go for the, after removing that, we can go for the Snehana procedures. Snehopanaha Agni Karma Bandhana Unmardhananicha Snaya Sandhi Sandhyasti Samprapti Kuryat Vaya Vatandrita. So when the doshas are affected in Snayu Sandhi Asti, in such conditions go for the Sneha Upanaha Agni Karma Bandhana Unmardhananicha. Bandhana and Unmardhana. Snehana, as you know, we can go for the Snehana procedures like various external applications we can go for. We can go for the Tailadara, or we can go for the Sneha Pichu. We can go for the various kinds of Pinda Swedas, Siddha Pinda Swedas generally. Patra Pinda can be utilized, or Dhanya Pindas we can utilize, Snigdha Churna Pinda, various kinds of Pinda, Snigdha Pinda Swedas we can utilize. Then Bandhana and Unmardana, Agni Karma, Bandhana and Unmardana. Agni Karma, if it is Snayu is involved, we have to surely go for the Agni Karma. Otherwise, it is better to go for the Bandhana and Unmardana. Bandhana means the tight bandaging, proper bandaging. So, when we do the Upanaha, that is the benefit of the Upanaha, which indirectly help us to get the Bandhana also. Upanaha is Ushnapatta Bandhaha. So, when we tie the warm medicated paste onto the affected joint and doing a bandaging, which retained there for 12 hours, right? That is Upanaha. So Upanaha is the procedure which is very less common in practice. Maybe the difficulty in preparation of the Upanaha, the taking paste, mixing it with kada and amla dravya is required, and many other materials, right? So all together made into paste, made into warm, apply and keep the plantain leaf for any of the Vatahara Patras, then do bandage. So this is a very tedious procedure. This may be the reason that it is very less in practice. Only institutionalized practice only we can see the Upanaha. Otherwise in OPD basis and all, very rarely the doctors advise the Upanaha. But once you teach the patient one time, it will be easy for them to get it done in the home itself. It's easy because it's similar to that of the cooking only, right? आटा जैसा बनाना है. So there are only 4 basic contents in the Upanaha. One is the binding agent, second one is the Amla Dravya or Madhura Dravya or Brahmana Dravya we can say, and third one is the Lavana, and fourth one is the Sigdha Dravyas. These are the 4 major ingredients in a Upanaha. Binding agents in the sense any of the wheat powder, rice powder, any of these dhanya dravyas we can utilize for the purpose, because that will stick the medicine to the properly sticking it into the joints. But same time we should think about the dosha haratva of these churnas also. That is why the godhuma churna or the rice powder etc. is used, because they are vatahara in nature. The second thing is the gandha dravyas. I forgot that. Gandha dravyas. Gandha dravyas, the dravyas which are having the volatile principles. So that is why while preparing Upanaha also we should be very cautious that you should not overheat it. So with minimum heating only we have to prepare the Upanaha dravya. Okay. So Gandha dravyas, the churnas like Kottanchakadi churnam, Kolakulattadi, Padmakadi, etc., Surasadigana, etc. Any of these churnas as per the requirement, which is predominantly with the Gandha dravyas, can be utilized. Then Amla dravya should be there. To mix the Upanaha dravya properly, there should be some liquid. Generally the Amla dravyas in terms of Takra, Chukra, Paya, Pluta. So either we can use Takra or Aranala or Dadi, because they are Amla. Amla rasa is Vatahara in nature. And Paya, Kshira is also sometimes we can utilize, because the Brahmana, Madhura rasa pradhana, Brahmana dravyas also can be utilized to control the Vata. Okay. So that is why Kshira. And many a times in some part of the country they use in Upanaha the Mamsas also. Mamsa. Because Anupa Audaka Mamsas, they are Vatahara in nature. So that is why the fish and all they prepare, and that will be grinded and Veshwar. Yeah, Veshwar also. Generally fish is used. Anupa Audaka Mamsa. Fish is grinded over and mixed it with the Upanaha dravya. Yes, Jambira rasa can be used as Amla dravya. And then the another important ingredient is Taila. Taila should not be too much, because it may not it will prevent from sticking the dravya to the joints. Minimum amount of the Taila. Without Taila also Upanaha won't act. And because the action of the Upanaha based on the content of the dravya, because of the Ushnavirata of the dravya, because of the Gandha dravyas which is present in the Upanaha dravya, because of the Lavana which is present in the Upanaha dravya. So to get action of these dravyas, there should be a lipid media should be there. Then only the absorption of the dravya will be taking place. Okay. And after the Taila, the last major ingredient is Lavana. Udrikta Lavana, always it is mentioned in the Upanaha, predominantly with the Lavana. How we can decide predominance? For example, 200 gram of churna is there, total quantity of the Upanaha dravya is there. What is the predominancy? How we will decide predominancy? Generally, we can decide based on the quantity. But if you add 200 gram of Saindava, then it won't work. It is not the way to make it Udrikta Lavana. So in such conditions, generally whenever Acharya mentions Udrikta, excessive Lavana, excessive than the taste. For 200 gram of that quantity of food stuff, how much Lavana you need to add to make it taste? More than that you can add. Okay, so that becomes it Udrikta Lavana. So the total quantity of this paste is need to be applied and band-aid with the covering with the, any of the Vatahara Patras and all. Okay. So this is one of the why I am explained Upanaha detail, because we need to bring this into the practice, in day-to-day practice, in the OPDs and all. Because Upanaha Bandhana, because it is Ushna Bandhana and Bandhana is also there, and Ushnavirya Dravyas also there, Snigdha Dravyas are there, Amla Dravyas are, Brahmana Dravya. All the Vatahara materials are power packed in the Upanaha. So that is why Upanaha need to be brought into the practice so that the patient can get more relief. So only one thing, we need to teach them first. So that is why we keep it in our OPD a QR code for the Upanaha. And the patient can scan the QR code. We will write the medications in the prescription so that they can prepare themselves while going to the home. How it should be prepared and how it should be applied. So this can be adopted in the OPDs and all. You need not to explain in detail also. So just look into step-by-step guiding video we need to prepare once and just share it with the patient so that they can prepare and apply it in themselves. Because among the Sweda, Chaturvida Sweda, Tapa, Upanaha, Drava, Ushma. Among the Chaturvida Sweda, only Upanaha is mentioned exclusively for Vata. Exclusively for Vata. Because Upanaha is mentioned exclusively for the Vata Vyadhis or Vata Vikaras. So whenever we are sure that only Vata is involved, in such conditions we can go for. If Pitta Samsarga is there or Kapha Samsarga, we can make some modifications in the Dravyas, then also we can apply. But predominantly it should be Vata Vikaras. Other Dravasveda is mainly indicated in Pitta Samsrishta Vata. Pitta Samsrishta Vata. Other Tapa and Ushma, other two are indicated in Kapha Samsrishta Vata. Okay. And Vireko Mamsamedaste Niruha Shamananicha Bahyabhyantarata Snehei Asti Majjagatam Jayed. So when the doshas are in the Asti Majjagata Avastha, Asti Majjagata Avastha, then Bahyabhyantarataha Sneheir Asti Majjagatam Jayed. In the Mamsamedastha Avastha, go for the Vireka and Niruha and Shamanaushadi. And Bahyabhyantarata Sneheir Asti Majjagatam Jayed. Sneheir Asti Majjagatam. All the modalities of Sneha. Either it may be internally or it may be through the external applications. So Shamana Sneha need to be given internally, at the same time the Shamana Sneha need to be given externally also. Vahiparimarjana application of the Sneha, at the same time we have to go for the internal administration of the Shamana Snehas also. Vireko Mamsamedasto Niruha Shamananicha. This is very important. When it comes to the Sandhigata Vata, many times you might have seen that even after the joint swelling is reduced, crepitus is reduced, but still the patient is complaining of pain. Maybe the patient is having obese. So we may not be giving much concentration on the weight, body weight of the patient, because primarily when it comes to the OA knee, osteoarthritis knee, or the Janusandhigata Vata, they are the weight bearing joints. So always there is a threat over the knee joint because of the body weight. So at the parallel to the management of osteoarthritis of knee, we need to control the weight of the patient also. So proper guidance, proper medicaments also we can give. So that is why the first line is very important. When the doshas are in Mamsa Medastha, Medasashraya, when the patient are obese in nature, we can go for the Vireka, Niruha and Shamanaushadi. So Virechana is one of the good modality to reduce the weight, Snehapana Yukta Virechana. Snavasandhi Sira Prate, Sneha Dahopanahanam, Mamsajanam tu Samshuddhi, Shastra Ksharagni Karmacha, Ashtau Ninditike Yadhyaye, Medujanam Chikitsidam, Astyashrayanam Vyadinam, Panchakarmani Beshacham, Bastaya Kshira Sarpeshi, Tikta Kopahitanicha. So this is very important. Astyashrayanam Vyadinam. When the doshas are involved in the Asti, we have to go for the Basti as one of the major Chikitsa. Panchakarmani Beshanam. Panchakarma is the major modality need to be adopted. All the Panchakarmas we can adopt in these conditions. But in that also, Bastaya Kshira Sarpeshi. Kshirabastis are generally indicated. There are different varieties of Kshirabastis are there. So Kshirabasti, Kshirapayaka Yukta Bastis are there, or Panchaprasritika Kshirabastis are there. In the Prasritika Yogika itself, we can see different Kshirabasti preparations. Panchaprasritika Kshirabasti is one of the most simple basti which can be administered in the Janusandikatavada. Kshirodau Prasudau Karyo Madutaila Gritatrayaha Khajena Madido Basti Vatagno Bala Varnakrit, which is Bala Varnakrit in nature, which provides the Bala and the Varna also, increases the complexion also. So Kshira, Madhu, Taila, Grita. These are the ingredients, major ingredients of the, and other than that, the other Bastyangas also can be adopted. Coming to the Amavata, so as you know, the Amavata is a later addition. Some glimpses of Amavata we can see in Charaka Samhita also, but not directly as a disease entity. But some of the lakshanas of Amavata we can see in Charaka Samhita, especially in Grahani Chikitsa, we can see due to the Mandagni there is the involvement of the joints and all. So that is the, we can say, the first instances of Amavata which is available in the classical text. And apart from that, in the Lagutrais, especially in the Madhavanidhana and the Chakradatta, etc., we can see the detailed explanations of the Amavata. This is the shloka from Madhavanidhana. Viruddhahara cheshtasya mandagne nishchalasya sigdham bhuktavato hyanam yayamam kurvatastata. So nowadays this is very relevant also. So soon after the intake of the food, especially the oily or the nourishing food, we will be running around because related with work. Morning after breakfast, soon we have to rush to the office. We don't have time to wait, take a rest for 5 to 10 minutes. Soon, sometimes we may be eating the piece of chapati and running. So, Sigdham Bhuktavato Hyanam Yayamam Kruvatastata. That is also one of the major reasons. And Vayuna Prerito Hyama Shleshmastanam Pradhavati. So, these are the details. I am not going to detail into that. But one thing is major we need to notice here is the Agni. The involvement of the Agni is very crucial in the Amavata. So in the management also we need to take care of the Agni very crucially or very thoroughly. So Angamardo Ruchi Srishna Alasyam Gauravam Jura Apaka Shunatanganam Amavatasya Lakshanam. So these are the lakshanas of the Amavata. Angamarda, Aruchi, Trishna. Angamarda, body ache will be there. Then Aruchi, dyspepsia will be there. Trishna, excessive thirst. Alasyam, Gauravam, Juraha. Alasya, Alasata, laziness will be there. Gaurava, Gurugatrata. Gurugatrata, heaviness of the body parts and feverish feeling. And Apakaha, Shunatanganam. Apakaha, frequent indigestion or less appetite, we can say. Shunatanganam, swelling of the joint. Amavatasya Lakshanam. Anga Shunata need not be always in the joint. Other part also may get sometimes swollen. So these are the Lakshanas of the Amavata. As you know, the Amavata mainly with the Vata, and there will be the predominance of the Ama. Okay, so other doshas, whether the Pitta or Kapha will be involved in that, of course, there will be the involvement of the Kapha and Pitta also. But predominantly in Amavata, the Ama and the Vata, along with the predominance of Kapha also seen. Sakashta sarva roganam yada prakupito bhavid hastapada shiro gulfa trikajanu sandishu karoti sarujam shopam yatra dosha prapadyati. Wherever the dosha is involved, wherever the dosha is lodged, at that area we can see the karoti sarujam shopam. It will produce the shopa along with pain. Yatra dosha prapadyati, wherever the dosha gets samprati, or the sthana samshaya, we can say. Sadesho rujyate atyartam yavidda iva vrishchikaihi. So vrishchika damshavat pida, we can see, as if it is bitten by a scorpion. that much of severe pain we can see. Utsahahanim vairasyam daham cha bahumutratam kukshu kadhinatam shulam tata nidra viparyayam trichardi brahma murcha hridgraham vidvibandhatam jadya antrakuja manaham kashtascha anupadravan. So if you see the symptom complex which is mentioned in the Pravriddha Amavata Lakshana, there are the symptoms which is pertaining to the joints, which are pertaining to other systems also, which are pertaining to the, especially focusing on the GI. Many of the lakshanas which are related with the GI system also. The dosha predominance, pittas sadaha ragamcha sashulam pavananugam stimitam guru kandumcha kafadushtam tamadishit. Pitta sadaharunam. When the Amavata is associated with Pitta, there will be Daha Aruna. Sashulam Pavananukam. There will be the pain when it is associated with the Pavana. Stimitam Guru Kandumcha Kafadurtam Tamadi. Stymitya. Stymitya means Stimitata. Stickiness. Stickiness. Ardra Vastra Anavachadavat. So when the wet cloth is kept over the area, similar feeling we can see. Stymityam, Guru Kandumcha, Guruta, heaviness of the body, then Kandu, itching. These are associated with the Kapha. So in Amavata, if you see the Lakshanas thoroughly, we can classify them into association with Vata, association with Pitta, and association with the Kapha. Accordingly, we need to modify the medication or the therapy also. So, Samprapti of the Amavata we can see. So, Ahara, Vihara, Manasika, Mandagini will be there. Dushti by Tridosha will be there. Rasavadrotas, which moves to the Trikasandhi and Sandhistabdata and results in Amavata. Rasavadrotas, Daurbalya, Sandhishota, Shula, then results in Amavata. Or else Agnimandya, Amavisha, Samavata, Shleshmasthana, Dhamani, Dushti by Tridosha, and there will be Vyaktata of the Vyadi. So coming to the management of the rheumatoid arthritis or Amavata, or we can say gout. As you know, the rheumatoid arthritis is one of the autoimmune conditions and associated with the various pathologies, various systems also involved. But almost all the conditions related with the rheumatoid arthritis, maybe ankylosing spondylitis, or maybe other kinds of arthropathies, arthralgias, can be brought under the heading of the Amavata Chikitsa only. So Amavata Chikitsa gives a comprehensive guidelines for treatment of the various these kind of pathologies. The other line of treatment we need to adopt is the Vata Rakta Chikitsa. That also a very comprehensive treatment principles provided by the Acharyas for various other conditions. Like we can see the Kroshtuka Shirsha kind of conditions are there, or the different other gouty presentations are there. All these comes under the Vata Rakta Chikitsa. Like Langanam Swedanam Diktam Deepanani Katunicha Virechanam Snehapanam Bastayashchama Maruti Saindavadye Anuvasasya Kshara Basti Prashasyati. So Langana, Swedana, Tiktarasa Pradana, Deepanani Katunicha, Deepaniya Dravyas and Katurasa Pradana Dravyas, Virechanam Snehapanam Bastayashchama Maruti. Virechana and Snehapana. Virechana, Snehapana, Bastayashchama Maruti. So Snehapana doesn't mean that we need to go for the classical Shamana Sneha dosage. Instead, we need to prefer for after the Shodhana, if at all Vata predominance is there. Because even in the Amavata also, because of the continuous Langana, the Rukshana of the body increases, and that may result in further Rukshana of the increase of the Vata. So, which is very clearly, beautifully explained in the Jwara Chikitsa. Ruksham Tejo Jwarakaram Tejasa Rukshitasya cha. So there is the increase of the Pitta, which is because of the continuous Rukshana, and because of Rukshana again Pitta increases. Similarly, this happens in Amavata also. So we need to understand when to say stop to the Rukshana Chikitsa. When to say stop to the Rukshana Chikitsa. Identifying the end point for the Rukshana Chikitsa is very essential. Then if Rukshana is properly done, if the Mandagni is reduced, if the patient is having the good Agni Vriddhi, or the Nirama Lakshanas are obtained, in such conditions we can go for the Snehapana. Snehapana, as you know, in the Amavata, the best Sneha is always Eranda Tailas, because Eranda preparations have the dual benefit. One is it can reduce the Shota, it can evacuate the Ama, clear the Ama because of its Ushna Viryata, and at the same time it will reduce the pain also. Okay. So that is why Eranda preparation, there are varieties of Eranda preparations are available. Then there was Sadi Erandam is available, or the Nirgundi Erandam is there, Lashuna Erandam is there, many Rasanadi Erandam is there. Many Eranda preparation, Eranda Thaila preparations are available. So any of these Eranda Thaila preparations can be utilized. Then coming to the Saindavadi and Anuvasasya. So Saindavadi, Saindavadi, these Thailas can be utilized for the Anuvasana purpose. Ksharabasti Prashasyati. So there are different varieties of Ksharabastis are there. Ksharabasti doesn't mean that we need to go always Ksharabasti only. Kshara Guna Yukta Basti. Any of these Ksharabasti. So Vaitarana also can be given. And different Ksharabastis are also available. Even Erindamuladi is also Kshara Guna Pradhana. Gomutra, when we add Gomutra, it becomes Kshariya Guna predominant. So that also can be administered in the condition. Apart from that, in the Kafaja Vatarakta, as I mentioned in the earlier part, the Vatarakta is generally gives us a guidelines for the various joint pathologies and its management. So in the Vatarakta, in the context of Kafaja Vatarakta, Acharya says, Vamanam Mrudunatyartam Snehasveko Vilanghanam Koshna Lepascha Shasyanti Vatarakte Kafottare. So after the proper Langhana or the Rukshana Chikitsa in Amavata, that becomes Nirama Avastha in nature. But still, even though it is Nirama in nature, the complete evacuation of Ama from the body may not be happened. Stop.
10 minutes.
Okay. So, so that is why in the Kafaja Vatarakta, Chikitsa can be adopted in such conditions. Like Vamana, Murdu, Natyartam, Snehasvedo. Na Atyartha Snehasveda. Murdu, Alpa Snehasveda can be adopted. Vilangana, Langana need to be continued. Koshna Lepascha, Shasyanti, Vatarakte, Kafotare. And Koshna Lepas. There are many Koshna, Sukoshna Lepas are available. Like Kotanjukadi Churnam is there, Kolakulatadi Churnam, or Nagaradi. Nagaradi is mainly when there is the Rakta involvement is there, Nagaradi application. Otherwise, the best choice is Kotanjukadi and Kolakulatadi. And understanding the Sama Niramata. So this is one of the proposal we have recently published in Annals of Ayurveda. You can find it. Last month only it got published. Proposal for a personalized Panchakarma treatment algorithm for Amavata with a special reference to rheumatoid arthritis. So a treatment algorithm, a proposal. This is a proposal we have given, and we are doing the study now at All India Institute of Ayurveda in the same algorithm, and its result on the gut microbiome is also we are checking. So you can go through the paper in Annals in the recent issue. You can see the online, it is available, freely available. The complete paper is available. So algorithm, what is the importance of algorithm than a protocol? That is very important, because protocols are very much rigid in nature. Protocols are rigid in nature. Rigid in the sense within the boundaries, within the line drawn on the protocol, we have to travel. Okay, so this reduces the freedom or the application of yukti of the Vaidya many a times. which limits the possibilities of exploration of the other treatment modalities also. So that is why always go for algorithm, treatment algorithm than the treatment protocols. Algorithm gives a little more freedom to the Vaidyas, but within the purview of the science, we have to develop the algorithm with the expert opinion. Lot of refinement may be required, and after this algorithm is implemented, based on the algorithm, they are the guiding principles, we can say, some of the guidelines which is provided in each step of the disease condition, how to proceed further. So there again you can utilize your yukti after the reaching to that particular point, analyze yourself, the medicaments, therapies we can implement. This is from the Harrison's, the algorithm for musculoskeletal complaints, how to reach to the rheumatoid arthritis. This also you can go through. Coming to the cervical spondylosis. Cervical spondylosis is nothing else similar to that of the Sandhivata or the osteoarthritis only, because there are two kind of pathologies we can see. Some may be inflammatory pathology and another is the degenerative pathology. Whenever there is degenerative pathology, we call it as spondylosis, and the inflammatories there is itis. And in text, if you see, the terminology is utilized for the any of the neck pain or the stiffness, pain of the neck. There are three terminologies very commonly used. One is the Griva Graha, another is Griva Hundana, and the third one is the Manyastamba. Manyastamba, as you know, it is one of the most commonly utilized terminology. Stabdata is there. So, Griva Hundana, we can say it is purely Vatacha in nature. We can compare it with sometimes the cervical dystonia also. But Manyastamba and Griva Graha, there is always the involvement of the Kapha. So, again, we have to see for the Samavastha and Niramavastha. Whenever any patient of cervical spondylosis comes, the first thing which comes to your mind is which therapy? Griva Basti. It is a wrong practice. That is what I want to tell. Okay, so see the patient, analyze the condition, check for the tenderness of the area or the any sort of swelling is present. Many a times, 80% of the patients, they approach to treatment, they will be having tenderness over the back of neck, and many a times we can see visible swelling also. At that time, if you apply blindly Griva Basti, it not going to give any sort of result. So at that stage, we have to go for some of the external applications, Lepa preparations, especially in cervical spondylosis. The one of the best Lepa is Rasnadi Lepa, Rasnadi Churna, which is applied with Amla Dravyas, Aranala or Dhanyamla, with Dhanyamla, or simple warm water also will be done. Okay. Nimbarasa can be done. But if the swelling is less, only the pain is there, in such conditions you can go for same Rasnadi Churna along with Eranda Taila. Nimbamrtadi Eranda is one of the best Taila which can be utilized. So that should be applied, especially on the lower back of the neck and on the shoulders, and also in the anterior chest. So yes, there also we have to apply the Lepa first. So if you check the anterior chest, the patients having with cervical pain and restricted movement of the hands, many times the patients will come, and we will do the application of the oil on the joints and many times on the back, but we neglect about the anterior chest. In such patients, you just examine the anterior chest, there will be severe tenderness will be there. So yeah, in such conditions, apply the Lepa to the chest also. So after 4-5 days, that will reduce. Then go for the any sort of the Sneha Prayogas. Sneha Prayogas, especially Jambira Pindasveda can be given, Griva Basti can be given, Griva Pichu can be given. Instead of Griva Basti, the best modality is Griva Pichu, because after keeping the Griva Basti, on the back of the neck, the patient has to sit or lie down in a very restricted posture. That itself further aggravates the condition. So, in such conditions, avoid the Griva Basti, just apply the pichu, keep the pichu there and repeatedly heat it. So, that patient have free movement also, he can sit, and sometimes if you want he can lie down keeping the forehead over the hand, or else again he can sit. Repeatedly we can change the oil and making it warm. So, instead of Sthanika Batis, always better to go for the Sthanika Pichus. Nasya Karma is the another important modality which is in the cervical spondylosis. Whenever there is the degenerative pathology is there, always go for the Brahmana Nasyas. The best Nasya, simple and best Nasya for the cervical spondylosis is the coconut oil. Simple coconut oil Nasya. Coconut oil in the sense, it is not the hot pressed coconut oil, cold pressed coconut oil. So, or else you can prepare, ask the patient to prepare themselves. Take the coconut milk, after scraping the coconut, crush it and grind it properly, squeeze the milk, you can get the coconut milk. I think all of you know that. This coconut milk, just boil it for 10 to 15 minutes, it will separate with the oil. Filter it, keep it around 100 to 150 ml of oil may be sufficient for 15 days of application. And ask the patient to do the Pratimarsha Nasya with the coconut oil continuously. Same oil can be given internally also with the, any of the Kashaya Dravyas, Prasaranyadi Kashaya, etc. Trayodashango Guru Prasaranyadi, etc. So, this is one of the simplest application because it is a modified application of the Parinatagiri Kshiri Taila. Okay, if you can find it, that is one of the best thing. Otherwise, again there are some other Avarti Tailas are there, like Maharaja Prasarni is there, the Nundaram Avarti. All these also can be utilized for the Nasya Karma. So, coming to the last part, only 1-2 slides are there. I will finish with that. Management principle, Sama Niramata we have to understand. Sandhivata Chikitsa we need to always keep in mind. Vatara Chikitsa need to keep in mind. Amavata Chikitsa we need to keep in mind. Considering these things, we have to classify the condition primarily, very simplified form, what I am going to tell is, simplified form, we can classify into two. One is Samavastha and the another is the Niramavastha. So, Samavastha, we should never touch the area with any sort of oils, and Niramavastha, we can go for the oil application. In Samavastha, in all these three conditions, this is applicable. Amrutotaram Kashayam, Simhanada Gugulu, Panchakola Churna, Sanjeevani Vati, Chitragadi Vati, Rasnirandadi Kashayam. The beauty of the Rasnirandadi Kashayam, or we can say Cherry Rasnadi, in Kerala it is called Cherry Rasnadi, Maharasnadi or Cherry Rasnadi. Rasnirandadi is mentioned in the Vatarakta Chikitsa, but majorly it is given in the Amavata conditions, because which is having more Deepana Pachana Dravyas. So that is why in Amavata itself, when in Vatarakta itself, when Amanvita Avastha is there, Ama Avastha is there, or initial stage of Vatarakta we can say, there Rasnirandadi work well. Then Kokilakshakam Kashayam, Rasna Shumtyadi, Diguna Rasnadi, Sudarshana Churna, etc. etc. Then treatment modalities you can say Rukshana modalities, all the Rukshana modalities, Dhanyamala Dara, Ruksha Churna Pinda Sweda, Valaka Sweda, Kashaya Dera, Karpasa Pinda Sweda. This is one of the wonderful procedure, Karpasa Bija. Karpasa Bija, as you know, the cotton seeds. Cotton seeds need to properly cleaned and crushed, which need to be dipped in made into potli. Only cotton seed is sufficient, or else there are other few materials also there, like Saindava we can add, Erenda Mula we can add. This is mentioned in one of the texts, Dhanvantari, in Amavata Chikitsa. Yeah, potali is prepared, and the potali is heated in dipping in Dhanyamla. Okay, so only demerit of the Karpasa Bija Pinda Sweda is daily we need to change the Pinda, because we are dipping in Dhanyamla. So, dipping in Dhanyamla, warm Dhanyamla, then apply. This is very effective in nature. Or else another method also we can do, Dhanyamla we need to boil it, indirect heating. The steam of Dhanyamla will be coming. Above that, a cloth is tied over the mouth of the vessel. over that the pinda should be kept. So if it's a home remedy kind of thing, this we can advise. The little amount of dhanyamla may be sufficient, and with a single pinda we can utilize it for longer period. Then Shodhana Vastis and Virechana is the treatment. Nirama Avastha, we have to go for Maharasnadi Kashayam, Dashamula Kashayam, Manjishtadi Kashayam, Rasna Saptakam, Varunadi, Diguna Rasnadi, Prasaranya Adi Kashayam, Sahacharadi, Yogaraja Ugulu, Kaishora, Grita Yogas. Various Grita yogas like a Shatpala Grita, Induganda Grita, or the Panchatikta Guru Grita, or the Mahatiktaka Grita. All these Grita yogas we can adopt in the Nirama Avastha. And Taila yogas, as you know, there are n number of Tailas which is applicable in the Nirama Avastha of these conditions. Either some of them have special affinity to the particular areas, either it may be to the upper area or either it to the lower area, that we need to differentiate. And in case of requirement, more Brahmana is required, Avartita Tailas also you can utilize. If Rukshana is more degeneration is there, and Amavastha is nil, completely nil, then we can go for the Yamaka Snehas also, like Koyambu preparations in Kerala is there, because if Grita and Eranda Taila combinations are there. Then Snehana modalities, Pinda Svedas, Pichudharana, Upanaha, Basti Yoga, Shira Basti, Matra Basti, Tailadhara, etc. can be adopted. With these words, I conclude my presentation, and this is a quotation from Acharya Vagbhata, Namatra Matram Apyatra, Kinjit Agama Varjitam. So whatever presented from the text only, or from the seniors, or from my teachers, or from the learn from the patients by practice. Thank you. Wish you Hitayu and Sukhayu.